Showing up and for spending your afternoon with us, at least for a little while. We really appreciate it. My name's Dr. Nager. My office and practice is OptiHealth Institute. We're located here in just right outside of Baltimore, Maryland. And we're a new practice specializing in functional and regenerative medicine. And what that means is functional medicine, sort of the whole gist of it is to get to the root cause of illness. And regenerative medicine, the philosophy behind that is to allow the body to find natural ways to heal itself rather than using, for instance, medications, surgeries, things of that nature. And I think that dovetails very nicely into the discussion that we're going to have today on women's intimate health, sexual health. And what we're going to do is we're going to talk about various options that can help out with problems that some women may face that they may feel very uncomfortable talking about. Everything from vaginal laxity to vaginal dryness to stress urinary incontinence. And these problems are probably a bit more common than most would like to admit. And as a result, a lot of people just don't talk about it. It's common, it's present in society, and we're just, as a society, unfortunately, a lot of ladies are not talking about this to their doctors because it's uncomfortable. And some of the solutions that have been out there are not exactly user-friendly, so to speak. So they may be medications with side effects. They may be surgeries with side effects. And so as a result, they just don't have the conversation. So we're going to talk a little bit about some of the options that we have and some things that we can offer patients. And hopefully at the end of this, we'll have time for some questions. We'll plan on chatting for about 20 to 30 minutes or so and have a Q&A at the end just so that we can make sure that everybody's questions are answered. So without further ado, we'll get started on our slideshow. So we're going to talk a little bit about stress urinary incontinence. And so what is that exactly? And so the way we sort of define it is that some sort of stressor is causing urine to leak out of the bladder and through the urethra. That's the area that you urinate from. And it's sort of defined as urination when you laugh, you cough, you sneeze, you work out. Why? Because you're increasing pressure in your abdomen and in the pelvic floor muscles. And what happens is that's going to push down on the bladder. It's going to cause urine to come out and it's going to leak. Many times when women experience this, they'll end up having to wear panty liners or some other sort of absorptive pad in order to protect themselves from leakage. The other thing that you may have is that tampons may slip or they may not feel as snug inside the vagina. So when we meet to discuss some of these problems with our patients, we have a thorough consultation. And what we're doing is we're trying to figure out what's going on. What is the extent of the leakage? What sort of activities bring it on? How often does it happen? How much urine comes out? Have they ever had this evaluated before? Have they ever had surgery? So there's a lot that goes into trying to figure this out. And like I said at the beginning, you're not alone if you're experiencing this. This is a very common medical problem, unfortunately, in society today. So estimates are that at least a third of women will experience some sort of urinary incontinence, many times in the form of stress urinary incontinence. What's really surprising is that this is not just a problem that happens with older women or postmenopausal women. This happens in a fairly sizable proportion of female athletes. Why is that? Well, again, female athletes may be powerlifters, they may be collegiate athletes, they may be women who are engaging in a physical activity that's causing increased abdominal pressure. And that's going to happen anytime you squeeze or strain. So if you were doing Olympic lifting, if you were lifting heavy weights, if you were jumping up and down on trampolines, or as you can see in the photo, doing some track and field events, these may be things that increase intra-abdominal pressure and hence increase stress urinary incontinence. So what we see is that it can happen in young females, it can happen in older females, it can happen in postmenopausal women, it can happen in premenopausal women. So it can happen across the spectrum. So how is this affecting women's lives? What sort of effect is it going to have? And it can manifest in a number of different ways. We know that this is something that is embarrassing, quite frankly, and that embarrassment can lead to mental exhaustion. It can cause people to feel depressed because the reality is that they're worried that this is going to happen at a very inconvenient time. Maybe you're at dinner and you have to get up multiple times during dinner because it's very hard to hold urine. Sometimes it's just going to a family event or a social event, and the simple act of laughing brings out urinary incontinence. And so this is something that can drive many people to stay away from social situations. They may not attend parties. They may not go out to dinner with their family because they're afraid that they can't get to the bathroom in time. It's very, very trying and taxing, certainly from a psychological aspect. From just a regular old skincare issue, anytime you have moisture that doesn't go away, it's going to cause the skin to become irritated. If you leave anything that's wet in contact with the skin, and we know this from babies with diaper rash, if, for instance, the diaper isn't changed, they're going to develop a rash. And the same thing is true for adults. So if a woman has stress urinary incontinence and she has a pad in place, or maybe doesn't have a pad, and then has to walk around with wet clothing on for some time, this can lead to irritation of the skin. They can have breakdown of the skin, and it can happen again and again. And so even though you've got things that can be a barrier protection, what ends up happening is there's still moisture, and it can be somewhat irritating. So what are some of the things that are out there currently that some of our patients may have tried or that people may have looked into? Well, absorptive pads, which is sort of the first step that many people will go to, they're not necessarily cheap. If you're having to use them every day, if you're having to take your clothes to the laundry or to the dry cleaners, this can add up over time. It can be anywhere from $500 to $1,000 a year just on absorptive pads or diapers. And so depending on what you're using and how much you've had to engage with trying to stem urinary incontinence, it can be kind of pricey. The next thing that folks will do is pelvic floor physical therapy. And I'm a big fan of sending people to physical therapists, but it's not necessarily for everybody. What happens is you have to commit to going a certain amount of times a week. And this varies depending on the degree of what you need or what you might require. Could be anywhere from 1 to 3 times a week. So from a strict compliance standpoint, for a lot of patients, that's very difficult. And so they can't necessarily make the appointments. They can't necessarily get there. And what they're focusing on in pelvic floor therapy is they're teaching you how to do Kegels. And Kegel is the act of contracting one's muscles that would be utilized for either having a bowel movement or having urination. And they teach you how to do this. Sometimes physical therapists will send you home with some biofeedback, but the limitation is it's tough. It's a lot of therapy, and it's a lot of visits, and sometimes it's not covered by insurance, or you have to pay co-pays each time you go. So while it's a great strategy, it may not be for everybody. Vaginal inserts, the most common one that we know about are pessaries, and these are essentially devices that are inserted into the vagina that will push on the urethra to help close the urethra down so that there's not urinary leakage. What can happen there? Well, it's a foreign body inside the vagina. It's there all the time. It can lead to foul odors. You can have discharge. It can cause irritation of the vagina. Unfortunately, it can also predispose women to urinary tract infections. So it's a therapy strategy that has been used quite frequently. The unfortunate thing is that for some women, it can cause some of the side effects that we listed. Then there's some other procedures. There's invasive procedures, and I think that this is sort of the last step for folks if the prior strategies have not worked. And so there are injections where they're injecting sort of a gel-like material, almost like a filler. And when you think about some of the fillers that are used for facial aesthetics, they will sometimes use those in the vagina to help place them around the urethra. And so how long does that last? It varies from person to person. You can sometimes also get immune reactions to those injections. And so there are limitations to that. And lastly, there's surgery. And the surgery is the most invasive of these strategies. It has, sort of long-lasting effects, but, some people are not surgical candidates. Any kind of surgery that you have can be painful. You've got to spend time in a hospital, and recovery time can be pretty lengthy. You're talking about 6 to 8 weeks of downtime after having one of these fairly invasive surgeries. So while surgical repair is something that a lot of folks will experience and choose as an option, it's also fraught with a lot of other issues, such as pain, expense, and a pretty long downtime. So one of the things that we're talking about today is Viveve. So Viveve has a number of different products, and the one we're going to focus on is the one that we use here in the office, which is a single session treatment. And so we'll talk a little bit about that treatment in a minute. And we'll also talk about some of the other treatments that we have available here at OptiHealth that can help out with stress urinary incontinence. The interesting thing is that many of these therapies can be synergistic or complementary, and I'll explain why as we go on. But we'll be spending time talking about the Viveve treatment. What exactly is it? Well, Viveve uses radio frequency waves to essentially create low-level inflammation through heating of the muscles in the vaginal wall. Okay, what happens? If you look here on the left, it's a sort of a microscopic depiction of what collagen looks like in the muscle. And collagen is a necessary component and constituent of muscle tissue. And over time, we produce less collagen, especially as we get older. So the collagen that we have that was very strong when we were younger is not as strong as we get older. Additionally, we don't produce as much collagen as we get older. So over time, they can lose the strength and the vitality that they used to have. You can see here that the Viveve device, the tip, when it's inserted into the vagina, will actually use radio waves to penetrate into the depths of the muscle tissue around the vagina. And what it can do is it can bring in collagen. So you can see this depiction after treatment. The collagen actually increases. It can gain strength. And when you have an influx of collagen, it helps out the muscle tissues, both of the vagina, as well as the tissue around the urethra. Why is the urethra important in all of this? Well, what happens is as you get older, the collagen that surrounds the urethra, which is the tube where you urinate out of, gets loose. And if it gets loose, there's nothing to sort of pin the urethra down. And if it waves around or it moves, that can be a contributor to urinary incontinence. So what we want to do is we want to firm up the tissue on both sides of the urethra so that it holds the urethra in place. And as a result, you don't get urinary leakage. So the collagen serves a role there. It also serves a role with regards to the vagina. When you have more collagen and more muscle and stronger tissue in the vagina, it can help out with vaginal laxity, which is another problem that women will experience after childbirth, as they get older, when they become postmenopausal, if their hormones are not balanced, that can all happen. So the nice thing is that the radio frequency waves from this device not only help out with stress urinary incontinence, but also help out with vaginal laxity and increasing the tone of the vaginal wall. One other advantage is that when you make the tissue in the vagina healthier through influx of collagen and growth factors and growth of new tissue, it also helps out with vaginal lubrication. So that's a third benefit that you will get from this device. How long does it take to work? Well, when we are making these changes in the vagina and in the tissue surrounding the urethra, it's not an immediate overnight process. Regenerative medicine, as I said before, works on having the body heal itself and create its own new tissue, healthier tissue, and that takes time. So usually we're looking at a period of anywhere from 6 to 8 weeks, sometimes as long as 12 weeks. But what we see is that those changes continue to manifest themselves in the patient, and you can see benefits even upwards of 6 months where you continue to see changes. But I always, like to be very transparent with my patients at the beginning. This is not something that you're going to go home and you're going to feel a difference the next day. It really doesn't work that way, nor would you want it to work that way, because that's how surgery works. You're going to see a difference the next day, but you're going to have pain, you're going to be sore, and you're not going to be able to use that area for quite some time. The beautiful thing about this device is it's an in-office treatment. It takes roughly 45 minutes to 60 minutes from the time you come in till the time you leave, and it's painless. We don't have to use any anesthetics. It shouldn't be anything that causes any discomfort. And we'll talk a bit about the technology in a moment, but it's a one-time treatment. So how does this differ? There are a number of different devices out there on the market. There are lasers that people have used. Those are sort of falling out of favor because lasers work by heating vaginal tissue. And when you heat vaginal tissue, it accomplishes some of the different things that we talked about on the slide here. The problem is the lasers were not only heating the tissue, they were actually burning the tissue. And the FDA wasn't happy with that, so they've come down on a number of the laser companies, and folks are shying away from using these devices now. There are other radio frequency devices out there. The problem with them is that radio frequency can cause heat as well. And so with using those devices, in order to keep the patient from having too much heat in one area, the probe has to be moved in and out repeatedly. And that may not be the most comfortable thing for a female. One of the nice things about the Viveve device is that it has an incorporated cooling circuit that encircles the tip and is constantly pumping the coolant around inside the device so that you don't feel a hot or heated sensation, so that it is not uncomfortable and so that it stays comfortable throughout the treatment. So one treatment, 45 minutes, and it is something that is long lasting. We can see the effects last anywhere from 6 to 18 months. Everybody's a little different. I don't like to just lump everybody into one category, but I think on average, a year is generally how long it will last, at which point many women will opt to get a refresher treatment. And again, this is regenerative medicine. The idea is you're allowing your body to regenerate. This is not a permanent fix for these problems. It is something that can be long lasting, like I said, a year to a year and a half, but we do find that a lot of women will want to opt to sort of refresh after that period of time. And like we said, very comfortable 45-minute treatment in the office. It's done with both myself and a nurse standing by. And we use the Viveve to essentially, like I said, provide those radio frequency waves to the lining of the vagina and the muscles underneath. And the tissue is cooled while it's providing heat to the tissue underneath. So like I said, it should not be uncomfortable. We don't need to use any anesthesia. We don't need to use any numbing cream. And it's very, very well tolerated. Like I said, women will typically start to feel the results, in my experience, about 6 to 8 weeks. Some women find that it works even quicker than that. Some of them will experience a result in a month. But the full effect usually takes about 90 days. And so we'll start to see that these effects will last even as long as 12 months. So how do you know if you're a good candidate? Well, generally, we're only doing this in women who are over the age of 18. So technically, anyone below 18 would be a pediatric patient. They would not be a candidate for this. If you're experiencing any sort of symptoms such as urinary incontinence, tampons slipping out or not fitting snugly, urine leaking out when you laugh, you cough, you sneeze, you jump, air passing from the vagina during exercise. In addition, I would also say that this device is useful for folks other than having stress urinary incontinence. As we said, vaginal laxity and correcting that through vaginal rejuvenation is what this device is very good at. So if you felt that your vagina was somewhat more lax over time and that you were looking to provide that rejuvenation, this would be a very good choice for you. Also, vaginal dryness would be another indication that I would recommend this device be used for. We don't like to use it in a period within 6 months of when a woman has delivered or has been nursing. So that's one of sort of the relative contraindications. So we want you to be a little further out if you've just delivered or you had been nursing. And so the other thing is that there is an absolute contraindication if you've got a pacemaker or a defibrillator that's implanted in your body. And so we would not be able to do it in a patient like that. So like we said, results can happen anywhere from 30 to 90 days. The collagen rebuilding process starts right away, but it's a gradual process. This is not a flipping a light switch on and off. This is a gradual process that takes time. And as such, is something that I want everybody to sort of understand before we begin. The studies have showed that when you improve pelvic health, you can reduce urinary incontinence. So many times we'll recommend that not only that we use this device, but that also that women will do Kegels at home. They can incorporate this with other strategies. So if they're seeing a physical therapist, there's no reason why they couldn't incorporate this into their strategy. They can certainly do Kegels at home. And then we have some other strategies that I'll talk about as we get to the end that sort of dovetail in very nicely with Viveve. Tell you a little bit about the treatment. Really, there's very little that goes into the prep for this session. You don't need any medications. You don't need anesthesia. You don't need any numbing cream. And what we're doing is we're laying you down on a table and we are inserting some gel called coupling gel. And what that does is it allows the device to couple with the tissue and effectively deliver the radio frequency waves to the tissue inside the vagina. Each time the device is utilized, the pulse is about 7 seconds long. And then we move it to the next portion of the vagina so that we're treating the entire inside of the vagina as well as the area on both sides of the urethra. And each time that it delivers that 7-second pulse, the cooling fluid is actually circulated through the device so that it cools the tissue and the surface so that there is no problem with excessive heat or burns or anything of that nature. The heating is all underneath the surface, and therefore you're not really feeling any pain or discomfort. That heating causes the collagen to sort of propagate and to be brought into the tissue. Now, You can have sensations of cooling or warmth during the treatment, but it's generally well tolerated. So everybody's a little bit different. And I always like to tell folks, different women are going to experience different levels of success. And that can be in regards to meeting their goals as well as the timeliness. But the idea is that we want women to know that there are options that are out there other than some of the traditional ones that we talked about. It's been proven, it's got a positive safety record. The nice thing, and this is before I incorporate anything into my practice, I always insist on looking at medical literature. And there is medical literature to show that this device is successful with regards to what we talked about. The effects can be pretty long lasting. I mean, a year is a very long time, especially if you've been dealing with this for some time. This can be a godsend. So we want you to know that this is something that it's quick and easy, 45 minutes. You don't have to go for multiple treatments. And then there's no downtime either. Women can engage in sexual intercourse the same day as the therapy. They really can go about their activities of daily living. No need for any downtime like you would have with surgery. I've talked to a lot of patients who have had the procedure done. These are just some quotes from patients who've had the Viveve treatment done. But what I've had as far as feedback is that it creates a situation where urinary incontinence is lessened, much less than it was before, so that it becomes a very infrequent problem. I've had women tell me that their husbands were commenting on the fact that the vagina had a more youthful feel during sexual intercourse, that the muscles were tighter, and that the vagina was no longer lax like it had been in the past. And that's going to lead to happier relationships, better sexual relationships. And really that's one of the goals that we're looking for is sexual optimization, to make sure that you're experiencing some improvement in your sexual as well as your overall life as a result of the benefits that you're going to get from a therapy like this. And just to sort of talk about some of the things as far as warnings or precautions, like we said before, if you're pregnant or trying to become pregnant, or you had just given birth or you were just breastfeeding, we would have to wait some time. We're not going to use it on anybody that's had radiation or chemotherapy. If there are open lesions in the vagina, we probably would not want to use it on a patient like that. We don't want to have any large metal implants, such as a hip replacement, artificial disc, because if the radio frequency waves are close to those, they can cause them to get heated up, and that can be uncomfortable for a patient. So we would not use them on patients that had those artificial joints or metal implants. If you're taking an anti-inflammatory medication, we would probably have you stop that prior to doing the procedure and then also hold off on it after the procedure was done, because we want a certain level of inflammation in the tissue, because that's going to produce the results that we're looking for. So we don't want an anti-inflammatory, because that would be counter-effective for the therapy that we're trying to produce. If there is any kind of chronic vaginal infections or any allergy to the components of the tip, then of course we wouldn't want to use it in those patients. But the reality is that there really aren't many contraindications to using this device, but we sort of like to be upfront about folks who may not be the best candidate for this sort of therapy. While getting ready to get into questions, I just wanted to talk a little bit about some of the other therapies and interventions that we have here at OptiHealth. One of the options that we have is platelet-rich plasma, or PRP. What is this? This is drawing your blood and then spinning it down so that we can get the portion of your blood that is rich in platelets. Platelets are the part of your blood that's responsible for healing. So when you were a little kid and you skinned your knee in the playground when you were little and you had all that yellow goo on the outside of your knee, that was platelets. And whenever we have an injury, platelets come in and help to heal. Well, in regenerative medicine, we use PRP quite a bit to affect a number of different positive effects. So it can be used in orthopedics, into joints, because it helps rejuvenate the tissues of various joints like the knees. It can be used for sexual health. So in women, we will inject into the vagina and around the urethra. Most people would say, wow, that sounds pretty painful. That without anesthesia can be painful. The fortunate thing is for that particular procedure, we just apply a topical anesthetic. We allow it to innervate the nerves, and that usually takes about 20 minutes or so. And then the procedure is virtually painless. And what's nice about it is it has a synergistic effect with the Viveve procedure. So many times we'll have women opt to get the Viveve treatment, and then they'll follow it up with the PRP in the same session, I should say. And what happens is you're getting two different modalities that work through separate mechanisms. So you have the Viveve device, which works through radio frequency waves, and then you have the PRP, which when injected causes influx of stem cells, growth factors, platelets, increases the amount of blood vessels and nerve endings in the area. So you get increased sensation during sexual intercourse. You get increased influx of collagen as a result of the PRP as well. So again, works synergistically with the Viveve, and can also help out with vaginal lubrication, and can also help out with some of the laxity of the muscles in the vagina. So many times we'll pair those two up, especially for a patient with stress urinary incontinence. We have another device in our office that works on the pelvic floor muscles. It's called the Emsella. It's a chair that a woman would sit on, fully clothed, and what that works on is causing contractions of the pelvic floor muscles, much like a Kegel exercise. And what happens is you have the equivalent of 12,000 Kegels in about 30 minutes. So who would that be a great candidate for? So the best patient for that would be a lady, or a man for that matter, with stress urinary incontinence, because it helps to cause contractions of the pelvic floor muscles, and again works in a complementary fashion with the Viveve. So where the Viveve uses radio frequency waves to bring collagen into the area, to strengthen the muscles around the urethra, and to help out with the vagina, the Emsella device is working on the pelvic floor muscles, which help to control urination as well as bowel movements. So a number of different strategies that we have. Well, also another strategy that we employ, since this is a functional medicine practice, is working with hormone replacement therapy. So for many women, especially postmenopausal women, if their hormones are not balanced, that can lead to some of these problems, such as stress urinary incontinence, vaginal laxity, as well as vaginal dryness. So many times we'll have women that will engage in treating this as well. We'll do in-depth testing to see what their hormone levels are, and then we use bioidentical hormone replacement therapy to help replace what the woman is no longer making on her own. And this can lead to dramatic improvements with regards to the strength and the health of the vaginal wall, lubrication, stress urinary incontinence, and the like. So a number of different strategies that we can engage in with here at the practice. And now I think we'll open things up for questions. And let's see what we have. Do we have any questions? Jenny's here with us at the office. She's our patient care coordinator, and she's been logging questions along with Lisa. So if anybody has any, thank you, Lisa. So I'm not seeing any questions. Lisa, anything on your end? Okay, I'm guessing not. So if there are no further questions, I promised that I was going to, well, we do have a question that just came in. We got a question: how are women over 60 responding to this treatment? Great question. They're responding just fine. There is not really an age cutoff when it comes to this device, other than we don't do it on women under the age of 18. So in a woman over 60, generally speaking, we're dealing with a postmenopausal female. And so we would look at hormone replacement therapy, certainly as one option to help out. And then we would engage in a therapy like Viveve, or quite frankly, any of these strategies used alone or in combination to help out. Because what will happen is that we want to present every option possible. And so in women who are 50 or 60 years old, I would probably say that the range of this device is probably most popular in the age range of, say, 45 to 65. So if that sort of gives you an understanding of what we're looking at with women and how they respond to this. Looks like we've got some other questions. What happens if I don't feel or see any results? And so the first thing that I always like to caution women about is that they need to give this time. And so, again, you're not going to see a result within the first couple of days or even first couple of weeks. Realistically, I'm looking at 6 to 8 weeks where you're going to start to see a difference. Now, most women do very well with one treatment. On rare occasions, women need to have a second treatment, in which case we bring you back to the office to perform that if you need it. But that's fortunately the minority of women. But like I said, every woman is different. Everyone's going to respond differently to this. And as a result, it's hard to generalize, but if there is no response after the first treatment, sometimes we need to repeat it. Let's see, we've got a bunch of questions coming in now. How quickly will I see results? I think I sort of just covered that one. With some women, it can be as little as 30 days. With most women, 6 to 8 weeks is probably about the time when you get what's called neurogenesis and angiogenesis kicking in. And neurogenesis and angiogenesis simply means the growth of new blood vessels and the growth of new nerve endings. And also it's the influx of collagen actually working its magic with regards to the muscles and knitting them together and making them stronger. And that's really what we're looking for. And so that's sort of the timeline that we would be looking for. Let's see what else we have. What is my recovery time? So recovery time is pretty much, like I said, you can return to activities of daily living pretty much right after the procedure. The procedure itself, like I said, takes 45 minutes to an hour in the office from start to finish. And then you can go about your activities for the rest of the day. There's no discomfort, there's no pain, there's no soreness. So, generally we tell people not to engage in theoretically vigorous activity that day, but no problem with going home, doing some walking, riding in the car. There won't be any issues. And like I said, some women will have sexual intercourse that night. Absolutely no problem with that. There's no pain, there's no discomfort. And people are sort of anxious to sort of try things out after the procedure. So I always encourage folks, if that's something that you want to do, there's no contraindication to that. Let's see if we have anything else. I think that's probably about it. If there's any other questions, feel free to type them in. We just got one more. If I like the results, but my symptoms have not completely resolved, when could I opt to repeat the procedure and could I get better results? Generally, what I try to do is have women wait a minimum of 6 months because the benefits of this device will continue to propagate up through the 6-month mark. If we have found that a woman has not had a response by 6 months, generally speaking, at that point, I would say that's a good time to re-engage with a repeat treatment. And so while that is, the majority of women will need that, that's sort of the timeline of what I would look for with when I would recommend getting a repeat treatment. See if there's anything else. Any other questions? Okay. All right. Well, in keeping with my promise at the beginning, I said we would talk for about 20, 30 minutes. We're about 30 minutes in. So I want to thank everyone for attending this. As I said, when you signed up for this, anybody that stayed till the end of the webinar was going to be eligible for a discount or a bonus. So we are having a sort of a contest for the folks that showed up today, that one lucky winner will win the procedure with $500 off. For anyone else that has attended the webinar, what I would instruct you to do is call our office, and our number is 443-707-2202. I think I can put that in the chat just so everyone has it. So that's the number to our office. And if you mentioned that you had watched this webinar, we will give you 10% off of the price of the procedure. And we would be happy to discuss that with you when you call the office. And so that's our way of saying thank you for attending the webinar. And it's a way to make the procedure a bit more affordable. And like I said, for one lucky winner, there will be $500 off the procedure. So that's our way, again, of saying thank you for spending some time with us this afternoon. So we look forward to hearing from you. Feel free to call us here at OptiHealth Institute, 443-707-2202. Or you can look us up on our website, which is www.optihealthinstitutemd.com. And I'll just put that in the chat box as well for folks. If you want to visit our website to sort of see a little bit about our practice, that would be great. And there is our website. So you can feel free to click on that and it should take you, it's a hyperlink. So thank you so much. We look forward to helping some of you to achieve the goals that you've been looking for. And I really do look forward to seeing you here in the office and being able to help you. Thank you once again.